Sound level's good?
Yep.
Okay. So this is our weekly press conference to bring you up to speed on any COVID-19 and related activities for the City of Plattsburgh. With me is my Mayor Pro Tem, Councillor Kelly. He can answer any questions, especially on the budget, certainly. I think you've already received the written daily briefing from me today. I'm very pleased that testing is finally starting to ramp up in the City of Plattsburgh. That's going to make a huge difference. As you know, we have to really begin testing of all of our healthcare workers, our frontline workers, our essential workers, those that are returning to work, those with doctor's orders, those are symptomatic. Then after that, of course, anybody who needs a test or wants a test should be able to get one at some point. But I believe we're starting to have enough test kits available to take care of all the latent individuals that we really need to have in some sort of a public health program and allow people to start returning to work. We're aiming for, as you know, in this area, return to work as soon as the governor lifts his pause order. We're confident that we can have various things in place by then. It's going to be dependent on getting more test kits, primarily though, to the county, and we're still working on that. But I'm confident from a personal perspective that in another 7 or 8 days or 9 days when that would come, that these test kits will be more available than they are now. They already are starting to become much more available than they have in the past. That's really great news. Some more good news is, as you probably have read, our hospital has now been given permission to accept patients for elective surgeries and more elective procedures, and that's really good news as well. As you know, that creates a little bit more of a sense of normalcy for our residents, but also gives an important revenue source back to the hospital. It's been really suffering because of this lack of other activities on their part. We saw today that the governor extended his anti-eviction policy for another 2 months till August 20th. And that's good for our residents. Of course, we're still very concerned about the property owners that may have to bear that brunt, and there's been no relief for them yet. But we're hopeful. The governor did say that he's working on relief for them as well. But it is relief for some of our tenants, obviously, that have found themselves without a job. Governor also noted in his press conference today that the healthcare workers themselves in that industry are doing an excellent job. They've actually have a lower level of incidence among healthcare workers than the general population. So that must mean they're redoubling their efforts to keep themselves safe. And if they can keep themselves safe, they're in a better position to keep us safe as well. Clinton County had one more case as of yesterday, up to 76 cases, and 3 more probables that they're currently awaiting more tests on. Our testing rate is still low, 11.6 people per 1,000 population. That's well lower than half of what it is in Warren County, lower than half of what it is across the country, and about a quarter to a fifth of what it is for New York State outside of New York City. Obviously, New York City is even a higher rate of testing, but we are starting to catch up, and that's really encouraging. And of course, you all know all the national and international news that this virus is continuing on. What I've been noticing is that we haven't really moved to the other side of the curve. We're starting to go down the other side of the curve, but as the governor said today, it was a very, very steep rise of the curve and a very flat curve downward on the other side. We're really not seeing huge decreases in numbers. We're kind of plateauing about halfway down that curve. But the really good news is that means it's much more manageable for the hospitals. I don't believe there's anybody in ICU right now, for instance, as we've got plenty of hospital capacity. And that's really what flattening the curve is all about, lowering the peak and spreading it out so we don't overwhelm the capacity of the hospital to keep up with them. So that's good, and that meant we have a lot fewer loss of lives. And you've also seen me say that in Clinton County itself, in the city, we've been doing very well. We were in the top third, worst third of all counties in the state early on. And because of our position between Montreal and our high New York City population through the college, et cetera. But now we're in the best quarter of all counties, and that's really, really reassuring. People have done an excellent job here, starting on social distancing earlier, and that's made all the difference in the world. A couple of budget things I would like to talk about as we start moving towards reopening in a very safe manner. Some of you may have already seen information from the New York State. It was in the newspaper the other day, for instance, that There's essentially a freeze on all grants and awards across the state, a freeze on all sorts across the state, but where it's going to affect us primarily is through grants and awards. We're very concerned about that. We don't believe at this time that it will affect any contract that has currently been let for some of the projects we're working on, although they may be in some jeopardy as well, but certainly is going to affect us moving forward on additional discretionary projects. We're monitoring that very carefully. And we also believe that may affect our AIM funding, as we've talked about in the past. AIM stands for Aid and Incentives to Municipalities. It's one of our largest revenue sources in the general fund. And the various groups that analyze this believe that that fund could be cut by as much as 50%. So that's quite a bit higher increase in the cut that we were anticipating even earlier on in our budget projections. And I know that the head of our finance committee is going to be talking about that a little bit with the council tonight as well. And then finally, many of you, or I think Channel 5 wrote, but many of you maybe have heard as well, that a lot of people have been receiving pink notes in their mailboxes in the last few days. These are reassessments. The county has a procedure to reassess properties on a kind of a continual basis. We went through quite a wave of reassessments in the city of Plattsburgh last year. But this isn't just a city of Plattsburgh thing. This happens all across the county. Our reassessments that the county administered totaled about a 4% increase in total assessments for the city. And how the council accommodated for that was to lower the tax rate by 5% to make sure that, if anything, people had a little bit more money left in their pocket than less. Other jurisdictions kept their tax rate constant or actually lowered their tax rate only a little bit, so those taxpayers actually ended up paying more because of the higher assessments. And that concerned us very much last year, because when people receive the tax bill, they don't necessarily notice that the city tax has gone down, but maybe the county and the school tax has actually gone up. We're also seeing another wave of assessments going out, including assessments to people that were reassessed last year and this year both. Some of them pretty sizable, some of them is upwards of 25% or more. And that's a real big shock to our city taxpayers. We're very concerned about that. I can't speak for the council, but certainly from my perspective, we're going to need to do what we did last year. If the assessments rise, we have to lower the tax rate by an equal or greater amount to make sure we're not pulling that money out of people's pockets, especially today when the situation is so desperate for so many households. So we'll, I'm sure, be discussing that in the near future. We've asked for an individual to come and describe the process to us from the county, and they'll be coming and speaking to us at 5 o'clock today. But there's also a policy element. He's simply probably just doing his job. We need to understand the policy and why, in a circumstance like this, could there not perhaps be a pause in doing reassessments for a year and then revisit them next year, just so you don't have that shock on people's finances. Because after all, in this area, your property tax assessment is probably one of the single biggest bills you receive all year long. For many people, it's bigger than their mortgage, believe it or not, their property tax bill. So to have that shock of all of a sudden, if you saw all of a sudden your mortgage rise by 25%, that would really floor you. Same sort of thing with property taxes. We're going to have to address that as a council, and that's a policy decision from the county to do these assessments. So we've asked the chairman of the group overseeing the assessor's office to also explain what the policy rationale was for doing those assessments at this time, and hope that other jurisdictions will follow our lead and also perhaps try to pause these sorts of reassessments at this time. We're trying very consciously to not raise any fees or taxes on our citizens and residents. As a matter of fact, this year we recently lowered the water tax on most all of our residents. So we're trying very hard to be very mindful of, yes, we're in terrible financial shape, but we're not going to solve our financial problems by simply transferring those problems on somebody else. Much of our problems is because the state's in an unfortunate position, so they're transferring some of their problems on us. Last thing we want to do is take that challenge and then push our problems on our taxpayers at this very, very desperate time. So you'll probably hear more about that in the future as well. And I know some of you have already been writing about your concerns about assessments, because you're hearing about that in the community as well. So that's all the announcements I have today. I'd be happy to answer any questions, or I'm sure We have two councilors here now, Councilor Moore and our finance, and both of these members are members of our finance committee, and Councilor Kelly, who chairs our finance committee.
Mary, so you said that we're hopeful to kind of be on plan to start reopening once pause is lifted. Do you have any idea what that plan's gonna look like? Has any, like, do businesses need to come with you with their plan to open, or is that like up to the state? Any idea?
As you know, I've been appointed to a reopening committee that is run through the county. Each county has a reopening committee. We're just formulating the plans at that level. What I can tell you is what the governor has described to us already, and that's all public information. He believes that that various counties or regions are in different stages of whether they can be reopened in mid-May. We meet 5 of the 7 criteria. Actually, Clinton County even meets the 6th of the 7 criteria. We've already got enough contact tracers in place to assure we can do all the contact tracing we've talked about before. There's 6 other counties. I think it's Jefferson and Lewis and St. Lawrence and Franklin, Essex, and maybe Hamilton might be in there. It also depends on them having contact tracers, etc. But we've offered to help out in any way if they need some contact tracing resources. And you've heard me mention before that actually some of those counties are farther ahead on testing than we are. So we may need to do a little bit more work in testing. They may be almost there in testing and testing kits as well. But I'm optimistic we'll have all those things together and in place. And you also heard me say, but we should do nothing unless we can do this safely. So the plans you're asking about is, do businesses have a plan for social distancing? It might require spacing people out on a shop floor, or having half as many people come, but over 2 shifts instead of 1, so things are less congested. The first stage, as you know, is construction and manufacturing, and takeout food, which has already been continuing on an ongoing basis. So I'm actually confident that we can work with the various industries for that phase 1 opening. We'll keep our fingers crossed. Public health is of paramount importance. Everybody agrees that it's primarily going to be a public health driven process. The next stage then is to open up some more industries, and I think in the second category may then be restaurants, and the third category is, I can't recall the exact order, the fourth category includes recreation, cultural, education, etc. Those would not be open until more likely the 1st of July kind of period. If we can stay to that 15 days between each phase, we can monitor, see how well it's working, making sure the infection rate's not going up, etc. So I'm much more hopeful, but the key thing is to have testing in place, have protocols in place, be able to maintain safe social distancing, and have that network of contact tracers at the disposal of the health department to really make sure this all goes off smoothly. But let's keep our fingers crossed. I think we can do it. We've shown such a great track record already in the city of Plattsburgh and Clinton County in adopting all these procedures well before anybody else, and that's really made a difference. So that's what gives me a lot of reason to believe we can actually be one of those groups of counties that can open up.
Awesome. So sticking with testing, we need just over 2,400 tests per month in order to get that last check. We need, today the U.S. Department of Health and Human Services says that they're giving New York about $40 million to help with testing. Is any of that coming here, or are you hopeful it does?
Well, it certainly will to some degree. As you know, those resources tend to go to New York State, and then they allocate them on some sort of formula they use. To now, we've done somewhere in the neighborhood of, I think, a little bit less than 700 or 800 tests in total. So we'd have to do 3 times more tests each month. And this 700 or 800 tests have, as you know, been over 9 weeks or so, 8 or 9 weeks. So we would need a huge ramp up. I believe we actually have enough tests in Clinton County to actually have a good start on it. If we were confident that the state could replenish those tests in the next couple of weeks, I think we may be able to start. But it depends also on the 6 of the 7 other counties outside of Clinton County, and us taking our model of contact tracing and extend that expertise to other areas as well. So I think we can do it, but you alluded to is really an allocation exercise. Can we get that $40 million out to actually purchase test kits? Can they arrive? And then can they get to the various counties in time for us to do what you'll imagine would have to be more like drive-in, drive-up kinds of facilities? And no doubt, at least one of those drive-up facilities would have to be in the city of Plattsburgh, given we have such a concentration of people here.
I've actually got a question about the Battle of Plattsburgh. So last night, a nonprofit organization announced that they would be taking over it entirely. And they also mentioned that their group was actually formed back in December.
That's right.
So could you tell me what that process was kind of like? Was it planned that there was supposed to be a partnership between the city and this organization for 2020?
Yeah.
Just explain that.
Actually, they even started a little bit last year, but they formalized it at the end of last year. They received their nonprofit status that allows them to go and fundraise. So we went from being the junior partner for many years to being the partner, the senior partner a few years ago, when a lot of the people in the Battle of Plattsburgh by then had, one of them I think has reached the age of 85 or 90, still kicking, great guy, all kinds of energy. But they felt they needed to start moving on, and there just wasn't that group of young people who were willing to fill in a few years ago. So in 2015 or so, the city became the primary partner, and then with some of the help from some of these individuals. With the goal, though, to really reestablish that as a viable and ongoing committee at some point. So last year we really started encouraging them and assisting them in getting up to that speed. We assisted in helping them with guidance on how to get their nonprofit status, etc. So they ended up getting it at the end of last year. So at that point, once they felt that they could be the lead agency, now we've moved into a support role. So we support them. We still have money in our budget for those sorts of things. Those in abeyance now because, as you know, a couple of weeks ago they just felt they could not do it this year because of the COVID-19. But if it weren't for the COVID-19, yeah, they were completely prepared. They've been meeting every week and contacting all the various performers and reenactors, etc. Our job was the vendors and the facilities and some of the music, etc. We were continuing to schedule all those as the junior partner, but it was really their show with us supporting it. So as you saw, they'd like to try and do something depending on how things look like in September. And if they want to do something, yes, the city will do whatever we can to support them, just like we did last year. So that's not new. It's just I think they probably would have wished to have more of a coming out party than this, but they're just merely responding to the COVID-19 in a very responsible way, I think.
Right, so right now that main event is canceled September the 11th, but the city can still support them in some ways moving forward for their virtual events, or just not
certainly, absolutely, yeah. And if they decide they can put on some sort of limited event, obviously be a decision of council, but the council, when they decided to reallocate budget based on that information, they also had a preamble to it saying, but if circumstances change, they would reconsider and reapportion those funds. So you're absolutely right that we're prepared to work as the junior partner with them anytime that they would like to come and ask us to. So I'm hopeful. You know, if this can all settle down this summer, including for July 4th, we've approached the fireworks person. As you know, we don't do the Mayor's Cup. The Mayor's Cup is actually a regatta run by the noontime or the morning Rotary. I don't know if they've exactly clarified their plans with whether they can proceed with that or not yet. But one of the events that we often do in conjunction is the July 4th. Now, obviously, at this point with pause and with all the governor's statements, he doesn't want to have people attracted to one area for recreational or cultural events for a while. We felt it was prudent to cancel the Mayor's Cup July 4th kinds of events under the premise that if we could put on a fireworks display somewhere later on the summer when all these orders are lifted, the person who actually delivers the fireworks, puts on the fireworks display, said he could do it at 48 hours notice. So maybe we could have some sort of combined Battle of Plattsburgh fireworks sometime in the summer, or maybe even later in the fall if they want to. But I think I speak for the entire council that we're versatile and we're willing to do our bit to get people outdoors and enjoying themselves just as we always have.
Thank you.
Mm-hmm.
Going back to the testing, are you concerned at all that, you know, Plattsburgh is meeting the criteria to possibly reopen because there's not enough tests here and that you're not getting those positive cases that maybe they're out there and we just don't know? Is that a concern at all?
I believe that our infection rate, for reasons I described, I think a little bit more detail last week, is pretty low. I think it's below or around 1%. In the city itself, it might be closer to 2 or 3% because we are quite a bit more dense and had more of the quarantines, etc. here. But Clinton County has I believe, one of the lowest infection rates anywhere in the state. The North Country has only a 1.2% infection rate based on antibody testing. And then when you compare the death rate, the number of positive cases, et cetera, compared to some other counties within the North Country, we are very low in those measures now as well. We used to be the highest of them all. Now we're one of the lowest of them all. So I believe that because of our social distancing, it hasn't penetrated our community very far. So that then says, well, if you don't have much infection, you probably don't need more tests. Maybe that's why we don't have so many tests, because we have a lower infection rate here. On the other hand, though, we need those tests to make sure that we can keep our infection rate very low and not have this become a hotspot. If you think about where all the hotspots are in the country, you can look at those maps. You can tell where those big blue or red dots are. They're wherever there's cities. Cities are places where a lot more people cross paths and are in one room together, etc. And that's where the hotspots occur. So this city is in the top third of population densities of all cities in New York State. So we have to be very vigilant, and we do that by testing to make sure that infections don't occur. And if they do occur, then you test everybody all around that person. We haven't been able to do that up till now. When we have a building that gets quarantined, sure, if it's necessary to quarantine it, but also then go and test every single resident in that building. And if any of them show positive, test anybody they came in contact over the last few days. That's what a good testing regime ought to be able to do, and we haven't had the test kits to do that. So we are going to have infections. If we have those test kits, we can then widen those circles of contact to really nip this in the bud before it gets very far at all. That's why we think we need a lot of tests like everybody else does, even if our infection rate is low. We want to keep it low. Does that answer your question?
Yeah. And then continuing with testing, you announced in the briefing today that Now Urgent Care is going to start doing antibody and diagnostic testing. Can you speak a little bit about that and who can go and get those tests?
Well, I'll give you a concrete example. A number of our first providers are going up and doing just that. They typically don't want to give the diagnostic test unless you have some symptoms, but still the antibody test will tell some of our first responders if they have been infected. So if we find, for instance, that none of our first responders have actually been infected, using the example I used earlier, that healthcare workers actually have a lower antibody test result than the overall population, because they're doing such a good job wearing masks and face shields than everybody else. So that's a really good thing. We'd like to know that all of our police and firefighters have not been infected. That will tell us that their procedures are going very, very well. So I see value in, if you have symptoms, certainly going and getting the diagnostic test and being quarantined, and then everybody you came in contact with goes and gets that test too. But also there's a lot of value in the antibody test to give us the reassurance that we don't have and haven't had pockets of infection in areas that we would not want to have those pockets. So a number of our employees are already being sent up to do just that.
So if somebody has symptoms, they can simply go to that urgent care and get a test.
In that case, there's doctors and physician's assistants that will diagnose the symptoms. If they're symptomatic, I understand they will be given a test.
All right, thank you.
And those that are like our firefighters and police, I believe that as first responders, they probably would also be given preference to get a test as well. And currently those are covered underneath our healthcare plan for the city of Plattsburgh. So that's really, really good news that we're starting to broaden those tests out. As you recall, a few weeks ago, they were only really used to figure out where a person would go in the hospital. Are they going to go to the COVID-19 ward or the non-COVID-19 ward? That's how the tests had been used. Now they're being used for more prescriptive public health aspects, not just triage hospital aspects. And that's the tool that our public health experts have been asking for, and I think they're finally starting to get that.
I saw, it's getting nicer out, people are excited to go outside this coming weekend, but like Praise Farmers Market has opened. Do we have any idea of when the Plattsburgh Farmers Market might open?
I think they announced around Memorial Day. They got a very complete procedure that they vetted through the Department of Ag and Markets, and they believe they're prepared to open. Our position is we're following the governor's orders. If the governor has something that allows for farmers markets to be open, and he does because it's considered an essential food industry, and if they can follow the protocols the governor has established, we'd love to see them open. But obviously everybody's going to watch the protocols very carefully, including members of the public. You've probably been in the supermarket and you see somebody not wearing a mask, and you've probably seen people being scolded for not wearing masks, you know, the public is very much helping in this effort. And so I'm very confident the farmers market is going to do exactly what they need to do. And it's gonna be a nice relief for people to get some fresh food. Anything else? Anything else of our finance committee? If you are able to watch on YouTube, I know they're going to give a presentation later on today on our finances, and we're doing that on a weekly, ongoing basis. Councillor Kelly and Councillor Moore are working every week in finance pre-meetings and then preparing a PowerPoint slide, so you can have some visuals from that as well.
What did you say again about the announcement that's being made at 5:30?
I'm going to be announcing a new councillor for Ward 4 to replace the recent councillor. So please keep that announcement, and the fact that you're going to be making an announcement embargoed to 5:30, but watch for it. Thank you.
Thank you.
Thank you.
Keep staying safe. Thanks for wearing your masks.